So we all know essentially what the problem is. The problem is that we are living to a greater age. We have much more sophisticated technology and medicines to spend our money on. We're living longer with complex medical conditions, and consequently there's a shortfall in money. We know that there's lots of think tanks and politicians, and this is in the news a lot now, with the suggestions of what we can do. And one of the suggestions is that we pay more tax, and that's certainly a suggestion I agree with. We spend less of our GDP on the NHS than most European countries spend on their health services. There's a lot of talk about rationing services or saying, that something is too frivolous or not necessary for us to spend our money on. That's something I don't agree with. But I'm going to put those sort of issues aside and really talk about something instead that is discussed sometimes, but I don't think it gets enough of an airing in public conversation, and it's something much closer to my own heart and to my own interests. And that's really that we spend so much time worrying about how we're going to afford to pay for the really expensive interventions that we have, but we don't spend nearly enough time thinking about how we squander our money on the things that are already available to us. So I think we are in the habit of using the NHS wastefully. I think that we mistake expensive treatment for good treatment. I think that doctors have a compulsion to need to intervene actively all the time, when sometimes the best intervention is no intervention. So really what I'm going to make the focus of my talk is going to be on over-investigation, over-diagnosis, pseudo-diagnosis, over-medicalization, and really how we spend so much money on what we refer to as low-value treatments. So in other words, things that have a very little chance of making people better and can actually sometimes be harmful. So in order to do this, I first want to just choose an example which will hopefully help you to kind of understand the issue at hand. So because I'm a neurologist, I'm going to choose an investigation, which is the MRI brain scan, and I'm just going to focus on that for a moment. So the first thing to say about the MRI scan is that it's an amazing innovation in medicine. It has revolutionized neurology. It has revolutionized medicine. It is an extremely high-value investigation because it gets people a diagnosis quickly, which leads to a treatment. However, an equal number of times, it is an extremely low-value investigation. So I want you to imagine now that you've come here and I have recruited you to be in a research study of mine in which you are all healthy volunteers. And I have, what I'm going to do is you're all going to have an MRI brain scan on the assumption that none of you have neurological symptoms. So that seems quite a good deal. You pay £10 for your ticket and you get a free MRI scan. But I think what I probably need to point out to you is the implications of the apparently generous offer that I have just made. So I can't actually see the audience, so I'm probably going to do a bit of a Diane Abbott with my numbers here. But basically, based on an audience of approximately this size, or whatever size you are, of these MRI scans of your asymptomatic brains, probably in the region of about 50 of you will have abnormal brain scans. Now, I'm thinking maybe in the region of about 20 of you will have something like a stroke that you never knew you had. Some of you will have cysts. Some of you will have abnormal blood vessels. You are actually quite lucky because maybe 10 or 15 of you will have brain tumors. I'm overestimating because let's count the empty chairs. But basically, 10 or 15 of you will have brain tumors. Now, when I find that on the scan, I will tell you that asymptomatic brain tumors are usually benign. You probably have nothing to worry about, and I hope that you're going to be able to accept my reassurance. But I will, of course, have to do follow-up scanning in 6 months and probably again after that just to make sure that I'm correct. Now, so far, you are all the lucky ones because there's probably another 15 people in here who have asymptomatic brain aneurysms. So aneurysms are little pouchings on blood vessels, and the problem with them is that they can explode, they bleed and cause brain hemorrhages, which is obviously very dangerous. Now, we know from following aneurysms over time that are found incidentally, that most of them that are asymptomatic, this doesn't happen to them. But once I found it on the scan, I can't guarantee you that you are the person who will not have a brain hemorrhage. I've got guidelines, but no absolute proof. I will probably advise you to ignore it and try and pretend that you don't have it. But I will have to advise you that there are interventions that you can have for aneurysms. And those interventions are usually radiological procedures where they inject a glue into the aneurysm. Now, some of you might say, I'd really prefer to have the treatment. I don't want to have an unexploded bomb inside my head. And those of you will probably be fine, but there's always a chance the procedure could cause the aneurysm to burst, and that could cause a brain hemorrhage. Now, I hope you're getting the point, which is basically that for those MRI scans that were completely unnecessary, for every MRI scan we do that is completely unnecessary in the first place, we lead to dozens of other tests that are then unnecessary. And that also affects the peace of mind of the people who are usually just having the scans purely for the sake of getting peace of mind. And the scan actually has the opposite effect. So we're led to believe that investigations and all these incredible new technologies are just harmless and inert things, where actually really it is not the case. We need to examine how the MRI scan, as I say, I'm just choosing the MRI scan. I could apply exactly the same sort of thinking to almost any test that we do. But if we look at how the MRI scan is used in the NHS, so there are guidelines. So headache, for example, it's the commonest neurological symptom. 50% of the country will have a headache at some point this year. And the vast majority of headaches are not due to brain tumors. And brain tumors hardly ever cause it's not the commonest symptom of a brain tumor. So the guidelines say if someone comes to you with a headache, unless these situations exist, you shouldn't do an MRI scan. And yet we still do them. Minor head injuries, low back pain. We regularly do MRI scans for these things against the guidelines because we think because we have technology that we should automatically be using it. And the fact that MRI scans used in this way become a very low-value treatment that also contribute to harm is not something that people consider. And we've got to ask ourselves, why do we do tests if we know that actually they're probably not going to help the patient? Some of the reasons aren't too bad. Some of them are because we want to reassure people. That's fine, as long as you've informed the person that you're reassuring of the potential downsides of the scan. Sometimes we do it because we don't know the risks. You've got to remember that some of the technology that we're using now has only been around in the last 20-odd years. When I qualified in medicine, anyone my age or older, there were no MRI scans when we qualified in medicine. So we're using technology now which we've only learned to use as we've been qualified doctors. So before the MRI scan, you couldn't see inside the body in this kind of astonishing detail that you can see now in a living person. So we didn't know that people had all these internal anomalies that we're now finding, but we're not certain what we're supposed to do about them. We also book too many things like MRI scans because we allow junior doctors to work without an adequate amount of supervision. So sometimes if you're not very confident, you don't want to take the chance that someone doesn't have something serious wrong with them, so you book a test. We do it because we are worried about missing things. There's an awful lot of criticism and scrutiny placed on doctors not finding things quickly enough. And any sort of underdiagnosis is very harshly treated, whereas overdiagnosis is absolutely tolerated. You know, I've never heard anybody complain about these incidental findings, when actually really these people might have survived quite happily without scans. You've now made a healthy person into a sick person. That's tolerated, whereas the other mistake, unfortunately, is very harshly treated, which of course it should be if a doctor hasn't been careful enough. But in fact, people aren't aware that overdiagnosis vastly outnumbers the number of cases that are underdiagnosed.